All set? Good afternoon, or early happy Thanksgiving to everyone. I knew this could be a different Thanksgiving for you. It certainly is going to be in our clan to have a more distant Thanksgiving, but I hope people can really celebrate and feel the love for each other. I believe that is entirely possible while still keeping everybody safe and hewing to our public health guidelines. That is necessary right now, and smart and wise and consistent with loving each other, because we are in the midst of a raging pandemic that I have to report has been most impressive in how fast this is moving. Right now, this activity is so high. Our statewide rate of COVID-19 transmission is 300 people per 100,000. We've had more than 6,000 cases that have been reported just in the last 3 days. And as the accompanying graph would indicate, we have almost a vertical curve on how fast this pandemic is moving upwards. It is really quite stunning and certainly alarming to all of us who understand what the future could hold if we do not act aggressively against this pandemic. Unfortunately, as a result of that, of course, hospitalizations are also near an all-time high. Nearly all counties have high and rapidly increasing rates of disease and therefore hospitalizations. As the chart indicates, our hospitalizations are essentially in the same area as they were in March, when we had to proclaim our first stay home order, and we all know how difficult those days were. Well, our hospitalizations are back either to or exceeding those levels right now. And unfortunately, we've already had several hospitals indicate that they're starting to plan to curtail elective surgery and other less emergent problems as a result of the crowding we're experiencing in our hospitals. This is why we have deliberately established targeted restrictions aimed at slowing the spread of the pandemic. And we are hopeful that they will work. We are hopeful that they will start to slow down this pandemic growth. When those measures are combined with Washingtonians' smart actions to follow science and protect ourselves and our loved ones, and that is going on across the state of Washington, and for that, we're very appreciative. We're not the only ones who have demonstrated a belief that Washington is an exceptional state. And the most recent evidence of that was an article today in the New York Times. The New York Times did a survey of Americans all across the country to determine which state had the most people, the highest percentage of people, who were acting safely to keep their Thanksgiving celebrations within their households. And they compared all the states. And they concluded that Washington State on that scale as to what state has the most residents per capita that are acting safely this year around Thanksgiving, the #1 state is the state of Washington. And we have led this country in so many different ways. This is just another way we are leading the country, and it's something we ought to be proud of. Because when Washingtonians have celebrations just with their immediate household this year, they're saving lives, and we've done this throughout this pandemic. That is why there are probably 45, 42 other states that are in worse shape than we are today, because we have acted to follow the science, and we have acted out of our sense of love and compassion. And we've done it yet again, confirmed by this data from the New York Times. So we're doing the right thing in so many different places, and we know if we keep doing this, we're going to knock this pandemic down. Now, one of the reasons we've been successful, I think, is that we have been sharing scientific data so that people can make decisions. And we'll continue to do that in a variety of ways. Our most recent, we're trying to provide people information in every form. The most recent is on a television commercial. I just want to show it to you. It started running, I believe, yesterday, if we can just play that.
When you're just trying to celebrate, it can find you here. When you're with your closest friends, or even here, when you're spending time with family. Wear a mask. Stay 6 feet apart. Don't host gatherings, even in your own home. Protect the people you love.
The point of this commercial is to share information we've learned, which is that we've been quite successful, we think, in bringing safer environments into the workplace, into our common areas by wearing masks and socially distancing. But what we found is that these social gatherings, football game parties, Thanksgiving dinners, these social settings are now something that are very dangerous, as dining in restaurants. So we wanted to share that information. There will be a commercial starting in the Spanish language as well, because we know folks who speak Spanish are, unfortunately, have been disproportionately affected by this pandemic, and we want to reach them. It is very clear that our small individual actions will tell the tale. There will be no single decision that will beat this pandemic. It will be the combination of 7 million decisions that can beat this dreadful disease. We have, of course, the medical professionals, the people in the front line, and we've got two folks on the front line that I'd asked to share some comments about what they have experienced and observed. Dr. Nathan Schlicker is president of the Washington State Medical Association, and Betsy Scott, a nurse and vice president of SEIU 1199 Northwest. They're just two of the voices who have seen the damage wrought by this, and I wanted to ask them to share their observations at the moment. Dr. Schlicker.
Thank you, Governor. I really appreciate the opportunity to be here with you to share this important message. While I serve as the president of the Washington State Medical Association, I'm also an ER doctor on the front lines, working to care for our friends and neighbors and our family throughout this pandemic. And I have to say, I appreciate so much your message of stay home, stay safe, and stay away from gatherings. I know that it's tough, but a test today, even if you go out and get swabbed, doesn't mean you're safe tomorrow or Thursday when we gather. And it's not just your small bubble, it's every piece that your bubble touches. And that's how the disease gets through all those little cracks in our safety net. And as you touched on, our hospitals are at record capacity. My health system is now above where it was in April, and many others are facing that tight crunch as well. We've seen it with surgeries getting canceled. And more importantly, even where we have the beds, we still need people working in them. Our staff is getting sick. We live among each of you, and so we struggle with having people to care as well as a place to care for them. And when we're talking about limiting surgeries, it's not like we're talking about minor things. We're talking about real diseases. I took care of a man last month who didn't get his defibrillator because it was pushed back because of the COVID outbreak and not having space to care for him. And he had his heart attack and his arrhythmia and didn't survive. I've got colleagues that are in their 30s that have chronic heart failure now from battling this disease and have sacrificed being out there. So when we talk about this, it's personal. It's not just personal because it's our family, it's because it's our colleagues, it's our nurses, our physicians, our janitors, our secretaries, our everybody that we see suffering with this disease. And taking it seriously like we do helmets and seatbelts is so critically important, because if we're going to respect the sacrifice that so many Americans and so many Washingtonians are making in this battle by being apart, by caring for each other, by keeping our distance, then we need to do what we can in our daily lives. And that means wearing a mask and not getting overly excited that just because the vaccine is on the horizon, it doesn't mean that we can ignore all of the public health measures today, because we don't want to see you in the ER. We want to see you healthy and at home with your family. Maybe not in person this year, but definitely there in person next year. And we share your frustration. We're all tired of it. I'm tired of the, fatigue of wearing a mask 8 hours a day or more in the ER, of, the bruises and rashes and, all that comes with that, all the struggles that we have. But we can't give up just because we're tired. We have to dive in and we have to do the hard work, because It's heartbreaking to watch people die from this disease or preventable. It's heartbreaking to watch people not get the care that they need because we don't have space to do anything other than COVID. And it's harmful when we see that people are denying that this is a real disease. This isn't a hoax. This isn't something that's no big deal, because it's not just the 1 or 2% that die from this disease. It's the 10% that have lifetime implications. And all those, like a young man that couldn't get his defibrillator, that don't get the care they need. So this Thanksgiving, I know it's tough, but from the medical community, please stay home, stay safe, and stay virtually together, but let's not gather in person and increase the challenges we've already got. Stay safe, Washington.
Thank you, Doctor. And what I really appreciate about your message is that we all have a stake in this. It has been such a misimpression that it's just people of age who have a stake in this. It's everybody, even if they're never going to get COVID, like you said. I'm sorry to hear about, a friend who was unable to get the defibrillator. COVID, he didn't get COVID, but COVID might have been responsible for his loss because he was unable to get treatment. And that's a situation that affects all of us, regardless of what age we have. So I really appreciate your comments. We now have Betsy Scott. Betsy, looking for your comments.
Thank you, Governor Inslee. Thank you for inviting me. I appreciate this opportunity to talk today. I'm a nurse and I'm on my hospital's COVID task force committee. Our committee has been meeting at least twice a month since Washington's outbreak in the beginning of the year to deal with all things COVID, from shortage of masks and other PPEs to quarantine pay and staffing issues. I don't work on the COVID unit, but I've had to face down the fear of being exposed without proper PPE protection and have almost daily conversations with coworkers who go to work every day fearful that this is the day they will get sick and take COVID home to their families. Recently, my daughter and son-in-law both got sick with COVID, and the realization that either one of them may have needed to go to the ER to receive care terrified me. And although they both became very sick, neither one had to access emergency care. Thank goodness, because I know what that experience might have looked like. For those patients that do have to go to the ER, there is overcrowding and long waits, with patients being cared for on gurneys in the hallways as they wait for a bed to open up in a hospital with too few staff. I imagine my 31-year-old daughter all by herself waiting to be admitted, for families not allowed to accompany patients into the hospital at this time. She is febrile, she has body pain, she's got a horrible sore throat, a cough, she's short of breath, and she's scared, and she's by herself. Finally, she's transferred to the floor that is short-staffed and where call lights take too long to be answered. 3 nurses called in sick, 2 with possible COVID, so they will be out for 14 days, and there's no one to cover them despite multiple emails and phone calls to all the staff to come in on a day off to help out. The nursing assistant assigned to care for her has 4 other patients, 2 of whom need one-on-one help to eat. So my daughter seldom sees her. Does my daughter call me as she continues to get more short of breath, more scared? Could I sit at home when she calls me crying to tell me that she's being transferred to the ICU, that she's scared, that again, she's all alone? Could I bear it when the nurses call me to tell me that my daughter's oxygen levels are dropping? There's a terrible shortage of nurses in this country. ICU nurses, because of the difficulty of the job, are amongst the shortest. We as a state are now competing with every other state for the ICU nurses out there as this pandemic fills our hospitals across the country. Our ICU currently does not have enough nurses. When my daughter, in my nightmare, gets to the ICU, the nurses haven't had breaks. They've been picking up shifts every week, working double shifts, working with a few traveler nurses who are getting paid premium hourly wages to come help us out. And they have nurses from other units who have had some training to assist the ICU nurses in the complex technical care required of ICU staff. They've been at it for 9 months. The nurses and staff are tired. They don't always see faces anymore. I hope they see my daughter's face. This was my nightmare when my adult children got sick a couple of weeks ago. Fortunately, they didn't need hospital care, but my daughter and her husband took over a month to recover and to return to work. This scenario is a living nightmare for thousands of other families and patients every day. They are living this today in Seattle, Spokane, Boise, Missoula, and elsewhere across the country. Please wear masks, everyone. Socially distance. Stay home for Thanksgiving. Allow our nurses in our hospitals, allow us to take care of those of us who need the care, and don't overwhelm us with more patients in the hospital.